there's really only a certain number of ways that a person can be helped in really all the fields of medicine. But for our purposes, our discussion now is how do we help someone, say, with clinical depression, which would be considered a mood disorder, or severe anxiety, a mood disorder, or not thinking clearly, cognitive impairment, problems with focus, concentration, hallucinations, transcranial magnetic stimulation. And that is a fourth level of intervention where we're using magnetic fields or pulses to target certain areas of the brain that are not functioning right and causing the mood disorders and the thought disorders. We identified areas of the brain that don't function when people are depressed or anxious, for example, or even thinking clearly, or having problems with sleep disorders or PTSD. And we can target those areas of the brain with the transcranial magnetic stimulation therapy to help improve a patient's mood or thought processes. Amazing success stories of people who literally were so anxious they couldn't leave their room, or so depressed that they couldn't get out of bed. And we start doing the TMS. It's a chore for them to even get to the office to begin with. But then once we get going, within a week or 2 weeks, they're completely starting to change. Hello, everyone. This is Dr. David Lopez, back with you to talk about transcranial magnetic stimulation. I know it's been a while since I was last online, I should say. I've been busy actually treating patients with transcranial magnetic stimulation, or TMS. Also recently attended a really high-level conference regarding TMS and learned a lot about what's going on in the field of TMS across the states and actually the world. And so just to give you a little bit of background about myself, I am a physician. I'm an MD. I went to medical school, did my residency in psychiatry and mental health. So I specialize in psychiatry in my day-to-day practice, and I help people who struggle with mood and thought disorders, substance use disorders, and things of that nature. And for the longest time, what I have done over the years, I have both inpatient and outpatient experience, but for the last number of years, I've been primarily focused on outpatient psychiatry, helping people with their mood disorders and thought disorders through prescription medication and some talk therapies, but mostly by and large prescription medications. And I should also state that I not only have inpatient and outpatient expertise, but I have worked in psychiatric emergency rooms over the years too. So I have quite a bit of experience with acute psychiatric presentations. But be that as it may, right now, as I mentioned, for the last number of years, I've been working strictly on an outpatient basis, prescribing medications. And over the last year and a half or so, I started to get into this new, really exciting treatment modality called TMS, or Transcranial Magnetic Stimulation. And TMS basically involves the use of electromagnetic energy, magnetic fields and magnetic pulses to help treat the mood disorders and the thought disorders that we've up until now largely treated with medications. So to recap, there's really only a certain number of ways that a person can be helped in really all the fields of medicine. But for our purposes, our discussion now is how do we help someone, say, with clinical depression, which would be considered a mood disorder, or severe anxiety, a mood disorder, or not thinking clearly, cognitive impairment, problems with focus, concentration, hallucinations. So traditionally, there's just been a few interventions. One would be, in severe cases, you could do surgery, which is a physical intervention, brain surgery, any type of surgery that's considered a physical intervention. Second would be a chemical intervention, such as taking a pill. And then the third would be electrical. In the old days, we used to use, and it's still used today, electroconvulsive therapy, or ECT. Now, as I mentioned, over the past couple of years, I've been getting into this new area called transcranial magnetic stimulation, and that is a fourth level of intervention where we're using magnetic fields or pulses to target certain areas of the brain that are not functioning right and causing the mood disorders and the thought disorders. And what we basically do is we take a sort of a picture of the brain, so to speak, and we identify the areas of the brain that don't function when people are depressed or anxious, for example, or even thinking clearly, or having problems with sleep disorders or PTSD. And we can target those areas of the brain with the transcranial magnetic stimulation therapy to help improve a patient's mood or thought processes. And again, that is in a completely novel way, without using medications, without using electroconvulsive therapy or even brain surgery. And so we've been doing this type of therapy, TMS, transcranial magnetic stimulation, with great success for a while now. And we've had really encouraging and promising results compared to the way we have previously largely treated patients with medications. And so that's why I'm online now, coming online to talk to people, is to spread the message that TMS is very promising, very safe in terms of not being it's non-interventional. You're not putting anything into your body. You don't have to worry about the side effects of medications. And in many ways, it's safer than traditional medications. And so we've treated many patients and we've had very good results. And one of the things that we've gotten with feedback with our patients is that they ask questions about the TMS, and they say, Dr. Lopez, you should go online and educate people so more people can know about this really awesome therapy. And I wanted to just go over some of the questions that have been asked by patients as we talk with them and come across people who are interested parties. And one of the first questions that was sent to me is, for someone who has never heard of TMS, how would you explain it in simple terms? So I think I've already started to explain it, but in terms of levels of intervention, TMS involves the use of electromagnetic energy or magnetic fields and magnetic pulses to help improve mood and also to help improve thought processes. It is non-interventional. It is holistic at its core. Because it is non-interventional, it's very high tech, however, because we're using pretty advanced machinery and electronics to stimulate the magnetic field and to precisely target the area of the brain that we're trying to treat. So in that way, it is pretty high tech. But what I would say is that we're using magnetic energy in the form of magnetic fields and magnetic pulses to help reset the electrical activity of the brain in a fashion that is a normal functioning. And so it's a different type of approach than a chemical intervention, which we take a pill or get a shot, and then that changes the chemistry of our body, our brain, our nerve cells. And this is different from the very start because we're using magnetic fields to improve the electrical energy of the brain, not the chemical processes of the brain. And so that's one way of looking at what TMS is, and that's how TMS helps people. For another question, I guess I just answered the question, is how is TMS different from taking antidepressant medication? Say you're depressed, you take a pill, that changes the chemistry of your brain. But if you get the TMS, we're actually resetting the electrical activity of the brain. And eventually that does affect the chemistry downstream, but it's a different approach. It's actually more effective and safer in my clinical opinion. Now, another question is, what conditions can TMS help treat besides depression? Well, I think it's important to note that TMS is FDA approved for only certain conditions, okay? So it's approved for treatment-resistant clinical depression, OCD, anxious or agitated depression, and with some devices, depending on the devices that, depending on some of the devices that you're using, smoking cessation. Some of the devices that are used for the TMS therapy would be also smoking cessation, but not all of them. And I think It's really important to emphasize that fact. These are the treatments that the FDA approves TMS for. Now, are there other conditions that people respond to when they get TMS? Absolutely. We're seeing that in clinical practice. Now, we're using it for depression first and foremost, but I think it's important to understand in the field of psychiatry, depression, there's different views on depression, which is a kind of mood disorder. A lot of people have different kinds of depressions. You can have how would you call it, a reactive depression, where you have a lot of anxiety as a component of your depression, or inability to focus, your mind won't slow down. That can all be because your mood's not right and you're depressed. On the other hand, you could have what are called vegetative symptoms of depression, where you don't have any energy, you can't get out of bed, you have no motivation, you have no interest, you just don't feel like doing anything. You literally can't focus or concentrate. The opposite of your mind won't shut down. It's just you're just so sluggish. It's hard to process. Your memory is not good. Those are all vegetative symptoms of depression. So these are all, and sometimes they're considered like as conditions unto themselves. Like you could have like a lot of anxiety, but it could be because you're depressed and you have a reactive depression. And so when we use the TMS to treat the depression, anxiety gets better. Or again, another thing could be insomnia, which could be also part of a reactive depression. When you get the TMS and you start to sleep better. On the other hand, someone who has vegetative symptoms of depression, all they want to do is sleep all day. It's a different kind of depression, maybe in a little bit different area of the brain, same area that regulates the mood, but just a little bit. So the precision of the therapy is very important in this instance. But what we do when we treat, you're treating reactive symptoms of depression or vegetative symptoms of depression, and you get a therapeutic response, and then people say, hey, I have more energy, I can focus and concentrate because we're treating the vegetative symptoms of depression. So label, the FDA is approving for depression and OCD, agitated depression or anxious depression, and smoking cessation. So we may be treating for depression, but people see a whole host of improvements in other areas. They focus and concentrate better, they sleep better, they have more energy, they're less anxious, they're more calm. Pain, we see a lot of response. A lot of times when people are depressed, they have physical pain issues, myalgias and such, or they have chronic conditions, but they're exacerbated, they're just worse. So when you are treating for an FDA-approved condition such as a treatment-resistant clinical depression, you may get the benefits that we're talking about: improved cognition, less reactivity in terms of you feeling more calm, you're sleeping better, those kinds of things. So I think, we start with the conditions that are FDA approved, but then we see these other conditions or other symptoms maybe of a global depression that tend to respond well to the TMS, the Transcranial Magnetic Stimulation therapy. And it's really cool when we see this, when we get these amazing success stories of people who literally were so anxious they couldn't leave their room, or so depressed that they couldn't get out of bed. And we start doing the TMS. It's a chore for them to even get to the office to begin with. But then once we get going, within a week or 2 weeks, they're completely starting to change. And within the course of 4 to 6 weeks, they're completely transformed in a positive way. Their quality of life is greatly improved. They're functional again. They're out looking for jobs, enrolling in school. It's just really amazing to see. And so that's what we're talking about when we're trying to get the message out about TMS, because again, it's non-invasive, it's very safe. I really believe that it's safer in many respects, safer than taking medications at this point in time. And it's very therapeutically effective. And so I hope this has helped. I know I've answered a few questions. I have other questions too, and I'll be coming back online to answer some more of the questions that I've been sent by patients who have had the treatment and really feel grateful and happy to have gotten this innovative and new kind of treatment. And then other potential patients, people who are suffering with mental health disorders who have an interest in learning more about TMS. So I hope this is helpful for you right now. And it's Dr. Lopez signing off for the moment, but I'll be back to answer more questions here very soon after being away for a while with clinical responsibilities and also attending a conference on TMS. Thanks, and I'll talk with you soon.